Is diabetes reversal possible, specifically type 2 diabetes? Hello everyone, this is Dr. Jayaditya Ghosh, consultant endocrinologist, Yashoda Hospital, Malapet. So here now we are hearing terms of diabetes reversal with the advent of medications in the form of semaglutide, tirzepatide. People are losing weight and they are talking much about reversal. There are lots of videos there which are talking that you can reverse diabetes in 3 months, you can reverse diabetes in 6 months. But let's come to the fact. What is the reality? Is diabetes reversal a myth or a reality? It is actually a myth, but you should be knowing two terms separately. There are term known as remission, which is possible, which is not a myth, but reversal. So what does difference between remission and reversal? In remission, there is decrease in the blood glucose. You may not require medication if you continue to maintain your diet and lifestyle. So once you lose control of your diet and your lifestyle is again going haywire, it is improper, then it can revert back. So this is the term that is remission. So what is reversal? Reversal is once you treat it, it is gone for lifelong. It cannot come back. So this is the difference between reversal and remission. In diabetes, type 2 diabetes specifically, remission is possible, but reversal, that is, if you treat diabetes, if it goes back to normal, it can be normal, but it cannot be there for lifelong if you continue consuming ice cream, chocolates, this and that, and do not have a good lifestyle. It will again revert back. So reversal is not possible in type 2 diabetes. It is actually a myth. So in case of infection, for example, if we treat it, it is ultimately gone for lifelong. You can do whatever you want, the infection generally do not come back, the specific type of infection. So that is reversal. But in case of diabetes, remission is possible. So this is the fact. So how does remission happen? So in early onset diabetes or diabetes for a lesser duration, that is for 1 year, 2 year, if they are obese, if there is 5 to 10% weight loss, if there is this much of weight loss, as I have said, so that can lead to decrease in the blood glucose levels and it can lead to diabetes remission. The newer medications in the form of semaglutide, tirzepatide have extensively studied and they have shown to induce remission in patients of type 2 diabetes, and they can stay in remission. That is, they may not require diabetes if they have significant weight loss, but they should follow certain rules and regulation. They should follow a very good hygiene in terms of diet. They should also have a good lifestyle, that is a proper sleep, regular exercise, and minimizing outside junk food intake. So these things, if kept under check, these diabetes indeed can go into remission with adequate weight loss and maintenance of that particular amount weight that they have achieved after the medication use. So this is very important. Remission of diabetes is indeed possible, but reversal is a myth. That should be noted. Those who say that reversal is possible, they should talk with facts. They should not just talk about only certain propaganda that reversal is possible. They should always talk with facts and they should provide adequate data that the patient has been followed up by them for 2-3 years and they are not reverting back to diabetes. Reversal, they will show that the patient is there for 3 months. They are not showing the data for 2 years, 3 years post stopping the medication. That is the most important thing. So we should always be cautious. Remission is possible, so we should be maintaining our lifestyle, maintaining our diet, and remission can be achieved in diabetes. Thank you.
If you found this video useful, like, comment, and subscribe for more health updates.